Is flossing important, and should I floss my teeth? The first question must be, what is dental floss? Dental floss is simply a piece of thread which can slide or fit in between the teeth in order to remove the plaque from them. So what is exactly the floss doing? To put it simply, it is removing the bacteria from your teeth which cannot be removed with your toothbrush. The areas of your mouth which form plaque are the surface of your teeth, and it includes the whole surface of the teeth. So a toothbrush can obviously clean the plaque from the biting surface of your teeth, from the smooth outside surfaces of your teeth and the inside surfaces of your teeth, but it cannot generally fit in between the teeth where the teeth contact each other, and this is where the floss is helpful. We keep mentioning the word plaque, and what exactly is plaque? Plaque is a sticky film of bacteria that forms underneath the gum line and on the tooth surface. If you have fillings or dentures or crowns or dental implants, the plaque can also stick onto these surfaces. The plaque in your mouth contains over 1,000 different types of bacteria, and they multiply very, very quickly, and that is the reason why brushing twice a day is advocated. So the next question must be, why should you be getting rid of this plaque or bacteria in the first place? Well, because it is sticky, it cannot be removed by just rinsing your mouth out. The only way to remove it is to literally scrub it physically. That's why we use a toothbrush and interdental brushes and dental floss. So one thing, if you ask any dentist, is that they do tell patients to floss, but very few patients actually do floss. So we'll have a look later on into the reasons why generally people tend not to floss. You may have seen recently that the Associated Press did a review of 25 articles on the benefits of flossing, and their conclusion was that it may not be totally necessary to eradicate gum disease and tooth decay. Obviously, when this Associated Press article review came out, patients must have been really happy knowing that finally the dentist may tell them to stop flossing because it may not have any proven benefits, but in reality dentists just kept telling their patients to still floss. There are a number of reasons for this. Firstly, not all dental academics agreed with the findings. Certainly the evidence in floss reducing cavities is a little bit hazy, because the most important factor in reducing cavities is your sugar intake, and especially the frequency of sugar intake. There is a much stronger link that flossing does help against gum disease, and in the Journal of Dental Hygiene they did one review of 12 studies and found that flossing does reduce your gums from bleeding, reduces bad breath, increases confidence, and importantly it helps to remove the food debris in between your teeth after a meal. So in conclusion, so far, flossing may not help significantly to reduce the cavities, because that is more related to sugar intake, but flossing does have a beneficial effect on the health of your gums. And we know that more teeth are lost through gum disease than tooth decay. Gum disease is generally an insidious disease and process. It occurs quietly in the background, and for many years you may not even know you have gum disease until you do notice that your teeth are starting to become loose, gaps are appearing between your teeth, and the fact that you may be starting to get gum abscesses. By that time, unfortunately, it is often too late, and extractions or having your teeth taken out become the only viable option. We know that in the UK 60% of patients will have some form of gum disease, and flossing does help to reduce gum disease. The two types of gum disease are gingivitis and periodontitis. Gingivitis is the early form of gum disease, and it is the less invasive type. Periodontitis is the more advanced gum disease, where your gums will start to recede, your teeth will get loose, and you will get gum abscesses. Periodontitis is termed as a chronic inflammatory disease which eventually leads to tooth loss. So although flossing clearly has benefits within your mouth on the state of your gums, it has long been recognized that the mouth is also a mirror to your general health. There are now countless articles which have found evidence that the bacteria found in your mouth can find their way into your bloodstream and cause problems elsewhere. These problems have been linked to heart disease, rheumatoid arthritis, diabetes, premature birth, and recently Alzheimer's disease. A very recent study found that patients who had Alzheimer's disease also had more gum disease, and in particular the bacteria Porphyris gingivalis was found in the brain cells of patients with Alzheimer's disease. Porphyris gingivalis is a bacteria found in the mouth which is implicated in periodontal disease. It is a gram-negative anaerobic pathogenic bacteria which produces toxins causing harmful effects in the mouth, leading to gum disease. The toxins that the bacteria Porphyris gingivalis produces were found in significant quantities in patients with Alzheimer's disease. So by now you should be getting an idea that flossing does have benefits to your mouth, to your general well-being, and that's why it is still continuing to be advocated by dentists and hygienists. So let's look at how flossing should be used. It is usually better to brush your teeth as thoroughly as possible and then rinse out the toothpaste before you start to use dental floss. This ensures that as much plaque has been removed with your toothbrush, and the function of the floss is then to clean off any plaque that is still remaining behind. These areas will be in between the teeth, before you floss. You should really wash your hands, because you don't know where your hands have been, and they might have bacteria which you are then transferring back into your mouth. So after washing your hands, and you've brushed your teeth as well, you can follow the guidelines by the American Dental Hygienists Association, which gives 4 easy steps to floss your teeth. They are easy to remember because they are wind, guide, glide and slide. The first one is called wind. For this you take out about 6 inches, which is like a small ruler length worth of dental floss, and you wind one end with the middle finger of one hand and the middle finger of the other hand. You should have left about 1 inch to half an inch of floss in between the fingers now. Number 2, guide. So with your index finger and thumb you grab hold of the floss, and number 3, glide. You push the floss or glide it gently in between your teeth. This is often where patients get stuck because either they find it too difficult or the floss won't slide down easily and it tears. When doing the gliding, it is usually best to move the floss backwards and forwards gently so that it gradually slides in between the teeth. This is especially important if the contact points between your teeth are very tight, or if the floss rips or even breaks off. So once the floss is in between your teeth, the next step is called slide. So now you will be using the surface of the floss to physically clean and scrape the plaque off those teeth, and this also includes passing the floss under the gum line as well, because plaque does also form under the gum line. In fact, the plaque under the gum line could be argued as being the most important place to clean, because this is where the bacteria are in close contact with the gums and will cause gum disease. Initially, I tell my patients that if you brush twice a day, do things gradually over a period of time, because if I say to my patients brush twice a day and floss twice a day, they can usually manage brushing twice a day, but flossing seems to be a really big effort and chore and has difficulties. The other difficulty with using floss can be that you are looking at a mirror, therefore you are working backwards to front, which is obviously can be tricky as well. So initially I say choose a few teeth, for example the top 6 teeth at the front of your mouth, and just start flossing those perhaps once a day. Once you have got the hang of that, then you can progress more to the back teeth, which can be more difficult. It doesn't really matter whether you start off with your upper teeth or lower teeth, as long as you eventually do get around to all the teeth, but you start off with what you feel is easiest. Some people have very tight contact points on the lower teeth, so I recommend that they start flossing their upper teeth first, because it will be easier, and especially the front ones. Once you do get the hang of flossing, you will notice that when you don't floss your teeth, your mouth just doesn't feel clean, and you become very conscious, and this shows that you have learnt about the benefits of flossing. Also, once you have got the hang of flossing, in reality it doesn't take up a long time. Quite often it will take less time to floss than it takes to brush all your teeth properly. Patients often ask me if there is any particular type of floss that I recommend. There are a huge, vast array of types of dental floss, from waxed floss to ones which are unwaxed, to spongy floss, floss which has got different tastes, for example mint flavour and even bubblegum flavour, and you also have dental tape and superfloss. Usually it's best to ask your dentist as to which type of floss they would recommend for your particular teeth. So for example, if you have relatively larger gaps in between your teeth, it's best to use a more substantial floss which will clean more plaque than a thinner one, as when your teeth are really tight together so it can easily slide through. One of the criticisms that patients often remark is that I don't floss because one day I did try to floss and my filling came out, or that it hurt, or that it made my gums bleed. Floss should not be able to pull out a crown or a filling if that crown or filling is sound. Nearly all the time when a filling has been pulled out by a piece of dental floss, it usually means that the filling was due to be replaced anyway, and it was probably getting loose and the floss just helped it on its way out. A sound filling or crown should not generally be pulled out with a piece of dental floss. So the second argument against using floss is that it is painful. This is no different to not brushing your teeth and letting your gums become sore, and when you do get around to brushing your teeth it does hurt. This is because gum disease is a chronic inflammatory disease, and due to the inflammation, whenever your gums are touched it feels painful and sore. This soreness or pain is only temporary because it means that there is inflammation. However, when you start removing the plaque with the floss regularly, the inflammation will subside and you will no longer get any pain from flossing. If your gums are particularly tender, initially you should try to be careful and gentle, but as your gums get stronger, then you can start flossing a bit more vigorously. The third objection that people have is that their gums bleed when they floss. This is similar to when your gums are painful because of the underlying gum disease that you have. Gum disease is an inflammatory condition, which means that your gums become inflamed, and when they become inflamed they will bleed if touched. And the inflammation is due to the plaque, and if you don't remove the plaque, the inflammation gets worse and the bleeding and the soreness also increase as well. So this is where you have to bite the bullet and not fret about your gums starting to bleed when you do floss. Over a period of time you will find that the bleeding stops or reduces significantly. If there are any particular areas where the bleeding does continue however much you floss, you should mention that particular spot to the dentist, because there could be some underlying chronic advanced periodontitis, and therefore the dentist can start to treat that accordingly. Finally, is it better to floss only or brush only? I would say that if you haven't, for instance, got time to do both, then you should brush as thoroughly as possible, and then maybe at a later time during the day or at night time floss if you can, but brushing comes first, and the flossing comes second as well, but they both have benefits in reducing the decay and gum disease in your mouth, which can eventually lead to tooth loss. Thank you.